Good evening, everyone. Welcome to December's Deerville Labs Speaker Series. It is great seeing everyone this evening. For those who have not attended in the past, Deerville Labs Speaker Series is a monthly event where founders and leaders share advice on how they overcame challenges, capitalize on their target market, and develop their products, providing you with actionable insight for your own products and processes. For more information, you can find us online at deervillelabs.org under our Speaker Series tab. I'd like to thank our sponsors for this evening's conversation. This free event is presented by Deerville Labs and is sponsored by the Harold Alfond Institute for Business Innovation at Thomas College, Valley Beverage, and Bricks Co-working and Innovation Space. In addition, this conversation is being recorded and will be presented for later viewing on our YouTube channel. This evening's conversation is presented by the Maine Department of Labor with Deputy Director of Maine Paid Family and Medical Leave Act, Reggie Parson. In this speaker series, Reggie will discuss an overview of the application process for the new Paid Family and Medical Leave program, which will be implemented in 2026. This speaker series serves as an educational platform, emphasizing that Central Maine Growth Council and Deerville Labs are not engaging in advocacy activities concerning the Maine Paid Family and Medical Leave Act or any associated legislation. We have not taken a stance on the program or legislation. And with that, I will turn it over to you, Reggie.
Awesome. Thank you. Thank you for that introduction. So yes, my name is Reggie Parson. I'm the Deputy Director for the Maine Paid Family and Medical Leave Program. As many of you know, this is a new program to the state of Maine. The legislation that was passed over the summer, so things have kind of escalated real quick in terms of the law passing, and now we also had to wait 90 days because it was a non-emergency bill. So we really, as a department, could not do anything legally because the law was not in effect. So we're past that date now of October 25th. So really, my goal here today is to try to provide you with as much information that we know of as a department right now as it stands. But then also try to take some of your feedback, as part of this process. So I hope to leave some room or some time for some Q&A. Also in the interest of transparency, because this is such a new program, some of the questions that might be asked tonight, I might not have a clear definitive answer to, especially if it gets to like the substantive stuff of PFML, because rulemaking will hopefully get to that part. And I'll explain the process of when that will begin. But I do have a website for you all to visit, and I can send it to you as well to share with others. But the website is www.maine.gov/labor/PFML/. This website will provide you with a link to the statute that was passed by the legislature, and then it will also provide you with like other information that we have public. So one of the things I will talk about tonight is listening sessions and outline those dates, which you can find online. But one thing I will ask you all, if you haven't done it already, is to sign up for the interested parties list so that when stuff comes from the Department of Labor, you are able to get those emails so you don't miss out. So with that, I will kind of go into just some of the things that we're focusing on right now as a department. And one of the things is getting a staff on board. So yes, I was the first official hire, if you want to call it, as the deputy director, but we are in the process of hiring a director for the program. And then other support staff with the program, because one or two people can't solely run this. And so that will begin to build with time. But having a director on board will be essential. So we're almost in the finishing stages of that process, but that's something we've certainly been focusing on. Another thing that we have been keeping an eye on, and I don't know if you all have been either, but there's a board that's called the Paid Family Leave Benefits Authority. So this is a 15-member board that will, we believe provide like general management and oversight, or provide advice and guidance about the implementation and administration of the program. 11 of those 15 seats will come from different sectors. So there will be some for employers that have 50 or more, and then employers with under more than 50 employees and employers with under 50 employees. There's going to be a seat for folks either in the agriculture or some heritage industry. There's a seat for self-employed folks. And there are also a couple of other positions that will come from the administration. Those 11 of the 15 are confirmable, so meaning that they will be appointed and nominated by the governor, and they'll go before the Maine legislature for a confirmation hearing, and they'll be confirmed by the state senate. That we hope that that process, the governor will have to appoint these folks by January 1 of 2024. So that's something that we're keeping an eye on. When it comes to getting involved in this process, and that's something I certainly would encourage you all to do in one way or the other. And one of the things that we're doing is holding informal listening sessions, and this is really an opportunity for individuals, and I'm not sure where everyone is, whether come from self-employed or employer and employee, but weigh in on things that us as a department we have to keep in mind for the purposes of rulemaking. Because if you read the statute, there could be various interpretations of that statute, especially a lot of provisions in there that might relate to what's the definition of an employee, for example, what is how you calculate benefits. There's so much to this law that we do have to navigate through in the rulemaking process. And those dates are listed on the website, but I'll give them to you here as well. They'll be the first one will be on January 25th, January 25th, February 1st, February 12th, and February 28th. And I can list those dates again if I went too fast. But those will be all held online from 5:30 to 7. We're almost in the finishing touches on coming up with the structure for the event. So when folks attend, they have an idea of how this is going to go. Because unfortunately, we only have 90 minutes together. So we want to make sure we maximize the ability to get feedback, but then also try to present information that will be at the listening session. But for those who are not available to access it online, there will be a way to come to the Maine Department of Labor in Augusta at 45 Commerce Drive. So we'll be able to watch it online there too. And speaking of when it comes to rulemaking, one of the things that we certainly have to have in place by January 1 of 2025 are the rules. So the saying building the plane while flying it, that is true. And so that's an opportunity for you all to also get involved in the process. We hope to start the formal rulemaking process by spring of next year. And that has its own set of process. So there will be a public comment period. So folks who, once the draft rules or the first draft is out, individuals will have the ability to comment on the rules saying, depending on where you're coming from or what you might read, that we might need to consider. And once those are published, we hope that will provide a framework as to what the program will look like. So taking the statute that was passed by the legislature and making it into something that is workable for employers, employees, and anyone else that will be eligible for it. And then obviously by May 1 of 2026, benefits will hope to begin to go out. So 2026 sounds like a long time, but it's really not when you're trying to stand up a program of this magnitude. So with that kind of really concludes my portion of it. And I just wanted to leave the remaining time for any questions or comments.
Any questions from the audience?
What do you foresee as maybe some of the more nascent challenges whether it's rollout, education, beyond the, public policy debate or discussion,
Yeah,
inherent probably in any big policy or legislation.
right. I mean, I think one, making sure that we have a staff that is like on board and ready to go and are trained because, like I said, building a plane while flying is a thing. So with implementing a program like this, there are always the risk of hiccups. I mean, at this time, there are none that I foresee that could be a huge challenge, but I think as we continue to go along, we hope to identify what those hiccups might be or try our best to anticipate them and try to mitigate that before, especially rollout, because that would be like the big thing. But between now and then, it's just making sure we have a staff and making sure we just have folks trained and ready to go. So.
Is the design, like in theory, obviously, I know there's still a lot to work out, but this to be an online program for employees to apply?
Yeah, that I don't know at this time. That is a good question. So are you saying like instead of like the traditional way, like, I don't know, people call the phone. I don't know if people call the phone to apply for paid leave. But like, is it something that has to be strictly done online or is there an alternative format? Like if someone can mail in the application?
Well, yeah, I mean, right now, all those things would come to the employee, the
Right.
employer.
Right.
And their forms.
Oh, right. Yeah.
So if the employee were to apply for this, is it the hope that it would be through an online system to do it?
I mean, other states, from what I've seen, seem to have an online rollout and already have the forms kind of ready to go, distinguishing, okay, here's a medical certification form, and then here's here's a family leave form if you need to take it off for birth or adoption. So we're in that research phase, but at this time, I can't specifically say if Maine is going to be 100% one way or the other, but
Mhm.
that is a good question.
Do you know if there's another state's plan that you're kind of following?
Yeah. So Maine is now one of probably, I think, a dozen states now that have a paid leave program. So one of the things that I've been doing, especially since I've been on board, is looking at, for example, what has Oregon done? What has Washington State done? DC also has a paid leave program. So there is a lot of research that I'm doing, and I'm also looking at maybe what their rules might look like to see if there's something that might mimic ours, to a degree, or if there's something that's the same, because that is something I'm realizing is that there are a dozen states and some are almost similar, and then some are a little unique. Just it depends on what the state it is. Like Oregon is a bigger state than Maine, obviously. So there's other things they have to think about, and their laws were written differently too. So, and we're also part of a network. So there is it's called NASWA. So they have like a network of states that already have paid leave programs. So we certainly have been bouncing off questions and ideas because other states are almost on the same parallel, like Maryland. They just adopted a paid leave program, and we've been asking a ton of questions of them about like how they've navigated through things that they have done already, but we haven't gotten there yet. Yeah.
So do you know, like, what's the process going to look like? Somebody thinks they have a need for this. What's the process gonna look like? I know you said you're not sure how they're gonna apply, whether it be an online portal or what.
Yeah.
Who decides if it's granted and who decides the conditions for each case?
Yeah. So I'm wondering if maybe the statute might provide some guidance. So I don't know if you've had a chance to look at like the statute that was passed.
Right there with it.
Yeah.
Detail.
So that might provide you with maybe some guidance about like employee notice, for example. That is one of the things that, we have to navigate through. The employee asked for leave, but then, there's the term undue hardship that's in the statute. We don't have a definition of undue hardship in the statute yet, but that is something that we have to navigate through. So we're going to take this statute that was passed and try to turn it into a program that's workable. So I think Yeah, I would say probably if you had when you have a chance to look at the statute, and that might give you some guidance as to a concept. And then the application hopefully will come through the rulemaking process.
When do you think the application process would start?
Oh, when I say application process, it's just, so when the rules are finalized, that's when like how the program will work. So that's when what I mean application, sorry.
Understanding rulemaking still occurs, it's probably a little premature, but either like misconceptions that you're hearing already that you wish people would know today, or like anything that you project into the future.
Yeah.
It's a very kind of passionate
I know, it is.
societal driven question.
Mhm.
This kind of deep public policy debate, like anything that is getting left out of the conversation, again, understand, probably premature.
Yeah, no, I mean, one of the things I would say is because it is such a huge law that will impact, I would say probably every employee and employer in the state of Maine. And then knowing there's a timeline on implementation, that just leaves a huge gap of like unknowns. And so that's really the purpose of being here today, is to provide like some education and understanding about where the department will go now that it's now passed and the legislature's done its part, and now it's on the department to make sure that we stand this up. It just really, the misconceptions, I guess, just maybe it comes from depends on what seat you're sitting in, because if you're an employer, you might be looking at, this is what I deal with on a day-to-day basis, this is the law that was passed, how do I navigate through this? I'm an employee, I might need to take time off, what does, certain concepts in the statute might mean, do I qualify, that kind of thing. So, and that's why sometimes I've been hesitant to say, oh, this is what the definition of an employee might look like. It's when we get to January, when we get to next year for rulemaking, that interpretation might look different based on the feedback that we get, based on the drafting of the rules, trying to also have it be in line with what the statute says. Yeah, that's a good question.
Maybe just as a follow-up, and again, likely a little premature, but can you like a little thumbnail sketch on some of the public input that you have received to date? Both challenges and opportunities, the kind of the employer and employee perspective.
Yeah, so as I was sharing before we started, so one of the things that I've been doing is doing kind of preemptive outreach to both the employer, like employers and employees or anyone that's been impacted. Notice to the employer is certainly something that I've heard from mostly employers or business groups. Other things I've heard about are contributions. So I know in the statute, there's a framework that says it's 1% of wages. If you're an employer with 15 or more, the break, in the statute says 50-50. If it's under 15, it just says 50%. People have questions about contributions. Another thing that has come up is FMLA and how this will interact with the paid leave law. Our statute has one interpretation, but we have a lot of questions about, can someone take 12 weeks off, for example, then roll into FMLA? That's what, that is something I've heard quite a bit. And I'm trying to think, private plans is another one. So if you're an employer who you believe has a paid plan in place, and I know the statute has an interpretation that says it has to be substantially equivalent to the law. And if you already have a plan in place, what does that mean? So yeah, I have a whole matrix of like questions and concerns that I've heard from folks. And that's something that I will, and I think us as a department will carry into that rulemaking process, is trying our best to try to answer some of these questions through that process.
I guess to add
Yeah.
into that, it's employers that already operate short-term disability, long-term, does that become a conflict, does it override?
Yeah, at this time, I don't know, because the statute You know, it has that substantially equivalent term in there that that's not defined, and if you an employer with maybe a sick leave plan in place, or you already have a paid leave plan put into place of short-term disability, I don't know yet whether that might qualify, because if you read the statute has an interpretation that has to be equivalent to what the paid leave law is, but that is something we have to certainly think about and consider.
They miss it,
Yeah.
statute, for how long the employee has to work with the employer, 1 year.
No, it's just, there's a definition of, there's just a,
Like.
Zero.
yeah, so there's a plain,
They have to work 6 weeks. They have to earn 6 weeks worth of wages somewhere prior
yeah.
to collecting.
The employer that they're.
Correct.
They
Yeah,
have
so,
to have contributed to the system for 6 weeks. It can be through any employer. And I don't mean to overstep.
Oh, yeah, no.
But it sounds like they don't need to have really any time with you.
yes,
Personally, they can have come from another job, come to you and on day 2 say, I'm dipping out for 12 weeks.
So the only caveat is they have to be employed,
That they,
they just can't be unemployed.
yeah, that's it.
one of the things I will say, I know that I think it kind of goes to the state average weekly wage, so in order for, one of the eligibility in the statute says that you have to earn 6 times the state average weekly wage in order to, and that's one of the eligibility criteria. I know there's been also speaking and kind of going back to the question of what have we heard from other folks? That has been something that we've heard, like if someone starts day 1, can they take leave? I mean, that's a fair question. That's something I've certainly documented. But I mean, as of now, I can't give a definitive answer as to like, that is the case. It's just what the statute said. Sorry, before I go, there is one more, provision in there that talks about, so for example, if you have worked for your employer, so there's 120 days. I don't know if anyone has seen that in the statute. So, you know, one example that, you know, we've heard is, like I said, day 1 can start. But if you, for example, you know, if you haven't worked for that employer for more than 120 days, then, you know, might be one interpretation that the employer necessarily might not have to hold that job for you, but if you work for that employer for 120 days or more, you have to return back to that job or something equivalent to that job. So yeah, that is something we certainly have heard. Yeah, so I'm sorry, go ahead.
Contracted workers.
It's totally exempt from the program.
The 99.
Yeah. This is like my little playbook. So I know in the definition of employee, and I'm just reading the plain language of it, it just says employee means a person who may be permitted, required, or directed by an employer in consideration of direct or indirect gain or profit to engage in any employment in the state, but does not include an independent contractor. So
they would be exempt.
potentially, but this is all feedback I need to get down, so thank you.
I'm just wondering, it just seems like we're encouraging more, we have a small construction company,
Okay,
and we would just make them all subs, you know,
Mhm.
as part of this. Seems like we're encouraging more subcontractors.
I mean, that sounds like a policy question I might not be able to answer, because our goal as a department is just to implement really what the statute says and try to offer some clarification to it, but that is.
If the goal is to try to help people get more paid time off,
Right,
this will probably, I mean, I can see this running contrary.
okay,
Mhm.
so you said subcontractor, so,
So right now, we like W-2ing our people, we have certain amount of benefits.
okay,
However, if we gotta pay for, I don't know, we'll have to do the cost analysis.
okay,
If the cost is too high, you know, we're getting 75% of that cost burden, it's $10,000 a year. We're gonna say, here's an LLC, guys, we're gonna lease you your tools, you got your own company, and then we'll employ them. Does that make sense?
that makes sense, yeah, but thank you for that feedback, so, okay.
For the 1% that you mentioned,
Mhm.
that's 1% paid by employee tax.
Yeah, so there's in the statute, there's a premium rate. So yes, beginning, based on the plain reading, it says beginning January 1, 2025, the premium amount may not be more than a combined rate of 1% of wages. So that's where it might get down to the whole contribution rate and depending on the size of the employer. So if you have 15 or more, it might look different than an employer that has under 15. For example, in terms of how do you split the cost of that 1%?
It's almost like the self-insurance at the state level. Is it a fund being managed by the state?
Yeah,
Insurance?
yeah, so there will be, so at least the intent is to have this be essentially like a trust fund, essentially. So the benefits will be paid out of the trust, the contributions will go directly into the PFML fund. And the purpose of that is to pay out benefits and administrative costs and
You know, if that would be housed in a state agency, it would be like under JABS or PERS, or would it be shut out to a third party?
The statute says, I believe the treasurer will keep hold of those funds. So, yeah, the treasurer will keep hold of those funds. Yeah,
State agency.
yeah.
Have you heard any discussions of, assistance for, employers who may be out of their help?
Mhm. That's something I've certainly been researching, and I think Oregon, for example, I think for smaller employers, I believe they have some type of a grant assistance program. That's something I've been researching, but for Maine, I'm not sure if we're gonna go in that direction, and if that might need a legislative change, because that sounds like a program that would need to be funded and created, but Oregon has a program like that provides some financial relief. I forget what the amount was, but yeah.
Could you walk us through a hypothetical use case of one person getting, you know, the needs of the city? Could you walk us through what that would look like?
I'm sorry, the 1% of,
Yeah, one person, just walk us through a use case of how this would work with one person, any work versus these leaves.
I can provide maybe the general overview. So I mean, an individual could take up to 12 weeks of leave, whether it's for safe leave. So these are individuals who might need to take time off because of domestic violence or sexual assault, and they need to take time off to, go get medical care, seek counseling, or go seek an attorney. There's family leave. So, for individuals who are expanding their family, whether it's through birth or adoption, they want to take that time off to bond with their child. Or there's medical leave. So for individuals who, have a medical condition that they might need to take time off for. There are different varying levels of leave. And what I mean by that is, there's also intermittent leave. So someone could, and based on how the statute reads, can't take no more than 8 hours off to deal with whatever it is. It might be a medical condition, it might be safe leave. And then obviously we envision that there will be an application process. They will apply. There's forms that would have to be filled out to certify, like, okay, this individual does have a serious medical condition, or for safe leave, if they need to take time off. I don't exactly have a sketch of like what the forms will actually say. But there will be a verification process to ensure like somebody has a medical condition or they're taking safe leave or family.
Preliminarily, it sounds like a 50-50 split with the state and the employer.
Oh, in terms of the contribution rate?
Right.
Oh, so it depends on, so you're an employer, okay. So if you have, and what the statute reads, if you have 15 or more employees, the split of the contribution of 1% for now will look different than an employer that has 13 employees, for example, and it's outlined in the statute. And I think, I don't know if it might produce more questions by looking at the statute, but I think looking at the statute might at least give you an understanding of what the law is trying to do. But yeah, right now it's capped at 1%. Or at 1%. So, well, I would not cap, but it's at 1% of wages. So the split will look, like I said, different if you have 15 employees or under 15
And
employees.
those numbers are not defined yet.
So in the statute, it says, let me pull it up. It does vary. Let's pull it up. So this is where I should have had tax, but either way, there is a 50-50 split, in the statute, sorry. Give me a second.
I think so. Your question is, so as an employer, you're not personally responsible for any particular amount of their paid leave. You're just paying into this tax pool.
Okay, got it.
Oh, is that what, so,
That's where, sorry.
oh, okay, yeah, sorry, I was giving it too long.
That and insurers, and I don't think about.
Well,
Yeah, cost wise.
Tax is gonna increase.
I mean, obviously that rate will most likely keep getting increased, but.
yeah, and I mean, we can't, well, I mean, the statute says at 1% of wages. Whether the rate goes up or changes, that unfortunately, I can't give an answer to now, like,
You know,
but.
like, someone from our team is out, and then we have to pick up 50% of that cost.
Well, the contribution rate will depend on, again, so it's at 1%, it's at 1% of wages. So, for example, I don't know how many employees you might have. You have 6, okay. So you would fit under the under 15 range, and so the statute says that the employer may deduct 50% of the premium from employees that will have to go into the fund. And if you were a large employer, so if you had 20, for example, 50 will still have to take, or at least you have the option to, take 50% from the employee, and the employer will pay 50%. So that makes up the 1%.
Got it, but
Yeah.
it's fixed cost for the year that I just passed on my clients.
As an employee, I guess I would defer. Yeah, I would defer. I mean, but if you are a large, but if, depending on like the size of the employee and the size of the employer, I would defer on how you pass those costs. But it is a good question.
Is there a specific age of the employee? Like, we actually employ high school students, so
Okay.
would they be eligible?
I've heard this question from another group. I cannot give you that answer to right now, because the definition of employee was just basically what I just read off. But that is something in rulemaking that we might have to clarify. So are you saying, like, if they're high school students, are they eligible? Is it age that you're?
Well, if they're a high school student, which
Okay.
would probably put them at 16, 17 years old, who they're
Okay.
still dependents of their parents, so
Right.
are they eligible for this?
Okay. That's a good question. Okay.
Yeah.
Yeah.
So, one of the big concerns that I'm hearing from people is about, potential abuse of
Mhm.
this program. And obviously, I'm sure you don't have anything for particular answer to that, but do you have anything in mind or thoughts on how to prevent abuse of the program, or what resources? You hear some of the states that have this in place, you hear some interesting stories.
Mhm.
But
There is one state, I think Oregon, that is seeming to be running into these issues, and I don't know all the details of it, but I guess there have been folks who have applied, like the actual person who's applied, and then I guess they get a letter saying, oh, hey, you have a claim that might, potentially fraud might be involved. And they're like, wait, I never applied. So that is something I think we need to monitor in terms of fraud and abuse, because that is also something I've heard as well, like, will individuals, or will this system be subject to fraud and abuse? And that's certainly not the goal, is to have a program that is that way, but we are trying to find ways to mitigate that potential once we get to that point of.
more so like the person, somebody's saying they need to care for their Uncle Ted in Hawaii,
And I believe.
again, I know it's getting into
Yeah.
specifics, but I just didn't know what your thoughts on how to.
Well, I think I mean, it's hard to say now, in 2023, but I think one of the things is the verification process. So, other states have this, so if you verify you have a serious medical condition, there should be a process to verify either through a doctor or, hey, this person actually has a serious medical condition. So like for that example, that's a valid one. If someone is taking time off allegedly for something that is really not a thing.
Right.
But verification process is something that we certainly will like keep in mind when these claims are being processed.
I'm just so, but why would I encourage, if I'm paying a fixed cost, let's say one of our employees has anxiety, like myself, and they want to take a couple months off in the winter. I mean, is there any problem not encouraging them to utilize this program? They'll just have fun.
Well, I was gonna.
Yeah, yeah, right.
I think I'm correct that seasonal workers often go on unemployment, right, when they off season.
Yeah, I'm not too familiar with the UI program, because that sounds like it goes to unemployment and when seasonal workers take unemployment or not, but so that sounds like it goes to like a medical condition. Yeah, for example.
Let's say, I mean, I don't know, it's right?
Yeah.
So it's wintertime, it sucks. I have guys that they're not, you know, they would rather sure not be working.
Mhm.
And I'm not saying it's because they don't want to, but I would encourage them, like, hey guys, if you're not feeling well, like this program you can utilize, no.
Well, I mean, so when we talk about a serious health condition, so there is a definition in the statute that says serious health condition. And it just reads an illness, injury, impairment, pregnancy, recovery from childbirth, physical, mental, psychological condition, that involves inpatient care in a hospital, hospice or residential medical care center or continuing treatment by a healthcare provider. So what people will use it for, I can't say right now, but I think,
Wellness within your company.
I mean, well, I guess, I guess that's, well,
Optimistic way to look at it.
yeah. Yeah, and I think it's kind of going back to the verification process. That's where, and this is totally a valid question, because there's so many, again, unknowns in the rulemaking process. We hope to clarify that, like, if someone has a serious medical condition, whether it's anxiety or whether it's something else, hopefully we'll have a verification process put into place for a doctor or a medical provider to make that diagnosis. And so, yeah, because we're not in the business of, diagnosing or determining what might constitute a
No, but
serious
there are a
health
lot of
condition.
positions that can help us with this and navigate it. I think this could be awesome for our employees.
Yeah.
Appreciate the kind of complexity and difficulty in navigating this.
Mhm.
You, say like 5 years in 2031, have any targets or projections on the eligible uptake rate or like participants served total in the state of Maine?
By 2031?
Yeah, I'd say 5 years.
Oh, 5 years.
10 years.
State of the nation, so.
I mean, well, it depends, but I guess that would depend on probably where the state is, with its demographics, with its economy at that time, and that I don't know the answer to, but that is a data metric that, that is something we would need to keep track of, because people could apply for leave for various reasons. And then it'd be up to, making sure that that claim is verified so that is a good question.
Do they have to work for a Maine employer or do they have to live in Maine?
That is I've got
There's
that
plenty of
question
people that
before.
work in,
Yeah, so
that
tell
live
it
in
to
New
me.
Hampshire, but maybe
Yeah,
work in
like,
Maine,
Yeah, so tell it
or
to me.
vice versa, maybe?
Yeah, that is a question that we've gotten and I've documented that I don't have the answer to right now. So if you have someone who is working in New Hampshire or in Vermont, but their employer is based in Maine, that kind of situation. Yeah, we've definitely documented that question. Don't know what that might look like, but rulemaking might clarify. Is there something
Or
You
like,
might have a
do they have to
question.
be a legal resident?
of the state of Maine?
Mhm.
Okay. What's the definition say that? Sorry, I'm going back to my manual.
I would think they would, in your rulemaking, I would think that you guys would set it up that because you have to have paid taxes in Maine, because this is a tax, this is an employee tax. It's an employer and employee tax.
Right.
So if I'm living in Maine and I work for a company, and I travel, my husband travels, okay? So he lives in Maine. He
Yeah.
pays to Maine and he also pays to any state that he works in, and he works all over the US.
Okay,
So technically, when he is not working, he could draw employment from any of those states, he just doesn't do that.
Okay.
But I would think in rulemaking, they would set it up so that it would be pretty cut and dry. If I paid taxes to the state of Maine, then I paid towards this benefit myself, and then I might be entitled to that benefit. No different than it would be for unemployment,
Mhm.
right? If my employer is paying unemployment for me in Maine, then I would qualify for unemployment in Maine, but I might not qualify for it in Florida, right? So I would think in rulemaking, they'd set that up.
yeah, that's something that is a good note for us to think about, because, I mean, obviously, there will be, just like your husband, who doesn't have the traditional, like, oh, they live in Maine, they work in Maine, you know, but we get it, and especially now in the era of COVID, after COVID, people work in different varieties.
They live in Maine because they could buy a house inexpensively, but
Right.
they work for a company in Massachusetts.
Right, and
Because
that's
they're
where, right, and, yeah. Yeah. That is good. Yeah,
Stating on $100,000 wage, you would pay $1,000 per year, $150 to pay expenses.
for, you mean as the employer or this?
I'm still not 1%.
Yeah, so the statute, reads a 1% of wages, so I would imagine that as an employer, you obviously have all the payroll and all of that, and then, you know, without getting too much an interpretation, just try to maybe apply what's 1% of that, of that, yeah, and I know there's a definition of wages that we also need to define or further define in our rule, because the statute, you know, lays it out, but, you know, wages might look obviously different, you know, for example, so. But yeah, if you read the statute, it's set at 1% of wages for the premium.
Utilization per employee.
Oh, I don't think the statute, so
So if I have one employee and they go.
can multiple take leave at the same time?
How many weeks can one employee?
Wow.
So 12, so it's 12 weeks, yeah, 12 weeks, yeah, the law says 12 weeks, to take up to 12.
For living then?
I don't,
Nope,
yeah. I
So
don't know.
any,
they
say,
don't have a reason.
10 or any less than 15.
So, I mean, I guess the size of the employer makes a difference in terms of the contributions, but the size of the employer, I don't believe makes a difference in terms of how many weeks can they take off. 12 is, yeah, it's capped at 12 in terms of,
Employees.
in theory.
Ever.
That's what you're asking, right? So we're
Simultaneously or at different times throughout the year.
Yeah, throughout a benefit year. So yeah, no one has to take 12 straight weeks off. So they could maybe take 2 weeks off or 3 weeks off, and they potentially could still have more left in a benefit year, but they cannot take off no more than 12 in a benefit year. And this is just the reading of the statute.
I guess what I was trying to establish, like, is the employer penalized if, you know, the utilization of this is higher? If multiple employees are using that, is their contribution rate going to go up?
I don't,
See how that would work.
yeah, I don't know if that's a good question. I don't know if they're entirely interconnected to each other, because an individual, you know, who needs to take 12 weeks off of paid leave will have that option in a benefit year. The number of employees or the contributions, whether that is affected, I don't think it's connected. I think it just comes down to the sole individual of, you know, I'm Reggie, I need to potentially take 4 weeks off because I'm dealing with a serious medical condition I have, you know, and then how that affects the other, you know, aspects of other employees might look different, because that one person is only taking 4 weeks off.
Yeah.
As Reggie.
So the limit, the cap on any one person is in a benefit year.
Yeah, how it's defined.
If that they could have code. current events or?
Well, yeah, I mean, and benefit, that's a good question. So benefit year, is defined.
Like I had a heart attack, but then my father died, like.
Oh, that would, I mean, one, that would just be a series of bad luck, yeah.
Like,
So, I mean, so, yeah, so the definition says, means a 12-month period beginning on the first day of the calendar week immediately succeeding. So, I mean, someone in theory potentially could take 6 consecutive weeks. I mean, if, you know, their loved one had a heart attack, followed by something, and that, so they have up to 12 weeks. So that, how they use that, I don't think the statute controls that necessarily, but they have up to 12 weeks of paid leave to take, whether it's for a serious medical condition. And I would imagine if the events are different, I would imagine the verification might look different as well. For a heart attack versus I forgot what the other example might be.
oh, my father died.
Oh, yeah, right, yeah, so that might be, yeah, those might be 2 different reasons to take leave, family and medical. But in that 12 weeks, they could take family, medical, or safe leave.
In that 1 year, that one
And
example,
benefit year, sorry.
for that employee, in one benefit year, take 4 weeks and then 6 weeks, like 6 months apart.
In theory, yes, I think. Yeah, in theory, yeah, that could be, as long, I mean, it can't exceed 12 in a benefit year, 12 weeks.
More questions?
Yeah.
Did owners think?
Wait, honestly, that is the first time someone has ever asked me that question. No, I mean, I know it's a serious, I mean,
They're being paid on the payroll.
yeah, I mean,
Yeah.
It- it-
that is
paying
actually
payroll tax.
very.
Taking dollars,
Yeah,
Yeah.
if you're on payroll, then I would say the answer is yes.
Yeah, in theory, the statute isn't, I haven't seen anything in the statute that says, I say in theory.
If you're a working
Yeah.
owner, then yeah, if you're getting a piece of the pie,
Yeah.
yeah, you'd be earning wages.
Yeah, employee, yeah,
So,
that's a good question.
going back to the benefit year, just
Mhm.
for some clarification on that.
Yeah.
It sounds like what they're doing is they're doing a rolling calendar. So it's based off of when somebody should leave. So it doesn't necessarily refresh on January 1st every year. If I took leave February, March, and April, and my first day out was February 1st, and I took all 12 weeks, I'm not eligible again until the following February 1st. It does, I just want to make sure we don't.
No,
have
that's a good
people
question, yeah,
Are out, let's say, October, November, December, 12 weeks. January starts and bang, I'm eligible for 12 more weeks. That's what I'm trying to make sure, is that it's not calendar year. A lot of us that run family medical leave out of our offices and have to track all of that, we run off of a rolling 12 months. So it's based on when you left.
when you actually took leave,
Actually took the leave,
okay,
and then you're eligible again at the beginning of that, which anybody
okay,
does family medical leave, you guys understand how that works, but if this is something that's based and it refreshes on January 1st,
mhm,
you could potentially have people to take 12 weeks and another 12 weeks right after that, and they're out for 6 months. That's what
Okay, that-
employers are saying.
yeah, I've heard that concern.
So that absolutely needs to be done.
Oh, no, clarify, yeah, and it's, yeah,
Question that I have as well is who's determining, what the person's level of benefit is, like what, we all make different money. So I know that it's not a flat rate for people, but what are they going to base that on? And then the reason, I'm gonna go into why I'm asking the
Okay.
question. There's a lot of people in the state who are an hourly rate, and it would be very easy for the state to say, yeah, we're gonna base that off for 40 hours at your $18 an hour.
mhm,
There's a lot of us in the room who probably have people who get overtime. We have overtime every week. I have sales reps.
okay,
So my short-term disability program is not based off of their base rate. It is based off of previous year's W-2 earnings,
okay, right,
because that is an all-in number. And if I based disability payments off of their weekly salary, they would absolutely lose out because the commission number is such a large number for them. So I'm assuming that the state's gonna determine what the
How to
amount of
calculate it.
benefit is, but I think they need to look at how are they going to determine that as well? And what data are they going to use
Yeah.
gather that.
And
Yeah.
so they need to come to the employer to have like a wage verification filled out or something.
Almost like
And
unemployment.
know what the employee's earnings have been over a period of time, because they're going, I'm assuming they're going to see some of the information, maybe because of the tax that we're also, if we're large enough that we're applying to our employee as well as the employer. No employer has, you know, there, if we can charge the employee part of this, we're going to. And I used to work for a company that had employees in California, so the employees paying into it as well as the employer paying into it. That's truly what's funding this. There'll be a lot of us who pay into this who never ever use it.
Yeah.
There'll be a lot of people who use it repeatedly. To your point of the abuse part of it, because the definition is extremely, liberal for the employee. I'm not gonna lie, my daughter's having surgery next year, and I was a little upset that this isn't going into effect for next year, because I will sit home for 3 weeks, she will have to have somebody at home with her, and I would qualify under the definition to be at home with her if the doctor says she needs somebody with her 24/7 after this surgery at home. So it is very, very broad in its spectrum, but I think there's a lot of questions, and this tax begins well before us being able to take the leave. I believe the tax actually begins in January of 2026, so that we're pre-funding.
25.
25.
Yeah.
So we're pre-funding this for a year and a half before people can take the benefit. That's why we're doing the tax that early. But we're 12 months away from that, without the answers on how we set that tax up and what that looks like. We all have to work with payroll vendors to get this all set up. Of concerns as far as that goes, and most employers in the state, they fall under FMLA, right? So we're all very familiar with having to look at documents and approve people's leave and tracking them and do all of that stuff.
Right.
The pay component is a whole different ball of wax, and who's figuring that out?
Okay.
What are they working off of? Because potentially this person only has to have had how many weeks?
It's six times the state average weekly wage, so it's, and that state average weekly wage is a number that comes from the Maine Department of Labor. I think right now it's at $1,103, so potentially multiply that by 6 over a base period, which is 4 quarters. That's how much someone has to earn, is that $6,000, and that might fluctuate. But I do want to get to how to calculate the benefits question. That's what it sounded like you might have had.
Yeah, I'm just curious who's gonna figure out, like, if someone applies for the benefit, who's gonna figure out what their weekly amount is? Who's calculating that? And where are they calculating that off of?
Right,
Where are they?
goes to the wages.
For
Yeah, yeah, okay.
My employee be taxed on that income?
Oh, that's a good question. We don't know for the state of Maine right now so the federal government has not given out any guidance that we're aware of on whether it's subject to the federal income tax. The state income tax, I have to look more into about whether it's taxable under Maine, but the federal government hasn't said anything. Other states with pay leave programs are also wondering that too, is it subject to a federal tax? We don't know.
And you said 6 times, or there was what was the number that you?
Oh, yeah, so $1,103, that's a number that is, that comes from the Maine Department of Labor. It's a number that comes from like all of the wages from the private sector, public sector, nonprofit, public sector, all of that data that's what makes the state average weekly wage, and then multiply that by 6. And so that would be the earnings that someone in theory would have to earn. So that's $6,000, and that might fluctuate because the state average weekly wage might fluctuate as well, to be eligible for that. I hope that answers your question. And then I think to the benefits question, so, in terms of the calculation of the benefits, it is outlined in statute. So if you read it, and that's where math comes into play, and that's one of my not strong suits, but it's really become a strong suit for me as of late because I've had to calculate this. So it is going to be based on a tiered system. So if you are an individual who has earned 50% or half of the state average weekly wage, so it's essentially cut that $1,100 divided by 2, you could potentially earn 90% of that weekly wage back. And if you earn more than that, one potential is that an additional 66% will be applied to that. So I know that sounds like a huge number, but the maximum benefit someone can earn is capped at the state average weekly wage. So for right now, if it's capped at 1103, I'm just throwing out a hypothetical. If someone's making, I don't know, if we calculate the benefit and someone's making, okay, 1,200, that we don't think that will be the case. The statute says it has to be capped at whatever the state average weekly wage is in terms of the weekly benefit someone will receive. So there is somewhat of a potential guardrail if that was a concern about how much someone would make. But the calculation of the benefit is in statute, but it's something we definitely need to clarify in rulemaking. What I just outlined is one potential theory of how it could be calculated, but we need to clarify that in rulemaking.
Just a perspective and more kind of not the scope of this law and more Maine Revenue Service, but Maine has in its economic incentive portfolio a program to reduce almost every tax for business, from employment, payroll taxation to historical child credits, child care credits. There's an abatement for almost every tax. Has that come up in dialogue on how quickly an incentive program to reduce the tax liability for this will emerge, likely predicated on industry segment, investment control, job creation, probably over a 10-year period, step down in 5 years.
Yeah, that has not, as long as I've been at least with the department, or at least involved in this issue. That's something I have not heard of yet, but that's, so it's essentially offset. Yeah, and
That'd
that,
be great to have like a little incentive predicated on early stage businesses.
like essentially offsetting.
Yeah,
Yeah.
exactly. I mean, that's how most incentive programs, right? It's a little carrot to reduce the tax liability.
Okay, I think we have time for 1 or 2 more questions. But then afterwards, we will allow anyone that would like to dialogue with Reggie as one more.
I had one more question. What about, I mean, I have several employees that, they are single people, they have a few children. They already struggle payday to payday. 1% might be, it doesn't seem like a lot, but it is if you've got 3 mouths to feed and you're a single parent doing that.
In terms of, the deduction that will come out, that's fair. And that sounds like more of a policy question that the legislature might have to consider, but that is, in terms of how you implement this and how you will actually do it, that is a fair assessment, but
I mean, if you're making minimum wage and you've got a family at home and you're the only person supporting them, that's gonna be a tough.
Sure.
All right. Well, thank you, Reggie, for joining us this evening.
Thank you.
Thank you to our audience for being here as well. This conversation has been recorded and will be available for later viewing on our YouTube channel. I'd like to thank our sponsors for this evening's conversation. This free presentation is presented by Deergo Labs and is sponsored by the Harold Alfond Institute for Business Innovation at Thomas College, Valley Beverage, and Bricks Co-working and Innovation Space. Thank you and have a wonderful rest of your week.